Welcome to another episode of Pearls of Wisdom, sponsored by Delta Dental of Massachusetts. My name is Dennis Leonard, President and CEO of Delta Dental of Massachusetts, and joining me today is Jean Terranova, Director of Food and Health Policy at Community Servings. Jean, welcome to our show.
Thank you so much. I'm delighted to be here.
Well, we're happy to have you, and before we even get going, we've supported Community Servings over the years. I personally have attended your gala and been very impressed with the work you do. So Community Servings is another example of a fine nonprofit doing great work here in Massachusetts. Before we talk about a great program that you've started, your organization started, called Food is Medicine, tell us a little bit about Community Servings and the role they play in the community.
Sure. Community Servings is a very special not-for-profit that prepares and delivers high-quality, medically tailored meals to people coping with critical and chronic illnesses. And as you're aware, many of our clients also have oral health issues that they're coping with.
And how long have you been in business? Your reach seems to grow every year, which is a great thing because the need certainly is not abating. It's increasing every year.
No, there's an incredible demand for the services, and we have been in business for 30 years, but we really have constantly been evolving with the needs of our clients.
Sure.
So when we got started, we were providing services to individuals who were dying of age wasting syndrome, and these individuals needed a high-calorie, high-protein diet in order to just survive until the medications became more available to individuals.
Sure.
And what started to happen is people were, with the medications, surviving longer with HIV and AIDS and developing comorbid conditions. And so now you have somebody who has HIV and AIDS and diabetes and heart disease. And so we really had to start customizing our meals for those illnesses. And then eventually we evolved to serve all individuals regardless of illness.
So it seems like a natural transition to the new program entitled Food is Medicine. Tell us a little bit about when that took off and what are some of the parameters around that.
Sure. So we started the Food is Medicine policy initiative about 7 years ago, and it's both a statewide and national initiative. We're part of a national coalition called the Food is Medicine Coalition, in which we're advocating for policies, for federal policies, in which medically tailored home delivered meals are reimbursed through Medicaid, Medicare, and other initiatives under the Affordable Care Act. And then we started to bring this work to a statewide level, and that's largely because of some of the research that we've been doing, which demonstrates that the service is a low-cost, high-value. Over the years, and part of our policy initiative involves conducting rigorous research to demonstrate the impact of our services on healthcare utilization and costs. We've conducted 3 studies that have been published in peer-reviewed journals, most recently in JAMA Internal Medicine, showing that these services, medically tailored home delivered meals, reduce utilization of the high ticket items like emergency room visits, inpatient admissions, ambulance services. And so in total, it's a net savings of 16% each month in medical costs.
So the return on the investment for health plans in Massachusetts has the potential to be significant. Nutritional deficiencies cause issues, whether it's diabetes or many other diseases that are out there, so critical. And it sounds like you've evolved from actually delivering the meals to being advocates on behalf of policies that will make sure that Community Servings and other organizations meet this need for years to come. Tell us a little bit about that.
That's exactly right, and that really is the genesis of the Food is Medicine statewide plan, which you've generously supported. So we see the value, we see the impact, but what we know is that there is just not enough.
Sure.
There are not enough organizations that are doing this work in the state. And so we got together with hundreds of individuals across the state to do an analysis of where our Food is Medicine interventions in Massachusetts, where are there gaps and what are the needs in terms of policy levers that we can help catalyze?
So you're doing great work. The organization is doing great work. And this program is about enlightening dentists, informing dentists. From an oral health perspective, talk a little bit about what the Food is Medicine program is doing from the oral health front.
Exactly. So it's just really important to not isolate. I think that we have treated people in silos for so long. And so, you think of mental health, oral health, nutritional health, they're all connected. And there is this kind of cycle where poverty is, you have poverty, which leads to poor nutrition and food insecurity, and then you have poor oral health. And it's just a cycle that keeps repeating itself. And so really nutrition is the one piece that can really break that cycle. And so it's really important. I think that what we found in our Food is Medicine state plan process is that dentists know that nutrition is really a key to good health and good oral health, but they are not really fully aware of how they can intervene with respect to screening for food insecurity, identifying resources for people who are food insecure, and then going one step further and saying, I can't just send someone to a food bank if they have, specific needs for medical and oral health, nutritional needs. They might need something more like what Community Servings provides, a meal provided to them at home that has, for example, a soft diet, low acid, that kind of thing.
So if you're a provider, a dentist, or a hygienist, or a dental assistant watching this program, what are some of the recommendations, one or two things you might point out that they could do in their practice tomorrow to assist with this problem?
So certainly start being more aware of the food insecurity issue. There's a very simple 2-question food insecurity screen that they can do, and that's all included in the state plan. And then identifying what resources are out there in the community that they can link the patient to if they are food insecure. And those resources are also available within our Food is Medicine state plan website.
Jean, I'm sure the audience wants to know, what are those 2 questions that should be asked in the dental office?
So the first question is really about resources, that in the past 12 months, the patient ran out of money and didn't have enough to buy food. And then the second is more about just the food, that they were worried, and it really has to do with that anxiety that the food that they purchased would not last until they had the resources that they needed to buy more.
And I think it's safe to say that this goes on in every community throughout Massachusetts, regardless of income.
Exactly. And so what we know is that 1 in 10 people in the state of Massachusetts is food insecure. And it can be, circumstances like being in what we think of as a wealthy community, having purchased the home many years ago, and now being house poor or something along those lines. So it really, we found this as well in our kind of regional listening sessions for the Food is Medicine state plan. You think of places like Cape Cod and the Berkshires as kind of vacation land, and so we might equate that with wealth, but actually there's quite a lot of poverty in those communities.
And where can providers go to get more information regarding the Food is Medicine plan in Massachusetts?
We have a website, and it is foodismedicinema.org.
So Jean, that's great. Those 2 questions are amazing. So let's play this out a little bit. There's a dentist that has someone in his or her office, and they've asked that question, and then clearly they've been identified as someone that falls into that category. What are some of the things they can do from that point on?
So if they're looking for specifically Food is Medicine resources, those resources, some of those resources are available on our website, foodismedicinema.org. But if there's more broad concern about food insecurity, connecting people to food pantries, Project Bread has a hotline for resources for people who are food insecure. So those resources might be a spectrum of food pantries, for example. And then there are also, fruit and vegetable prescription programs. There's a wide array of nutrition resources that are available for people who are food insecure.
So Jean, thank you for helping us and helping dentists who maybe before they see this episode felt that they had a somewhat limited role in assisting people with nutritional deficiencies and food insecurity. You have enlightened many of us about that situation, so thank you so much. For those of you interested, again, that website is foodismedicinema.org. This is a problem that's not relegated to certain communities. This is a nationwide problem and certainly a statewide problem here in Massachusetts, and we're so grateful that we have organizations like Community Servings that are helping with this issue throughout the state. And another key issue, and one of the reasons that Delta Dental is involved in this is, number one, we want to help people get healthy. But for bringing down healthcare costs in Massachusetts, this does a great job. People eating healthier are going to be healthier. As Jean mentioned, it's $1.9 billion of avoidable costs that this Food is Medicine program can help us with here in Massachusetts, which is one of the most expensive states in the country with health insurance costs. So thank you again, Jean. Thank you for watching. As always, we appreciate your comments. Please feel free to comment on the website or give us a shout. We'd love to hear from you, or if you have any ideas on another upcoming episode of Pearls of Wisdom. Thank you again, Jean, and have a great day.